Harry Bridges Plaza, first of all. Now, Harry Bridges actually was for single payer. He was for national health care. And that was in the 30s. Because Harry Bridges and the ILW believed that all working people should have health care in this country as a human right. Yes! A basic human right. And this was more than 70 years ago that they were saying we have to have human health care. Now today, this is a National Day of Action, and also it's a day when millions of working people in California and around this country could lose their Medicaid and die as a result of these cutbacks. We have to say, and it's very important, this rally that we're having today is the first National Day of Action to say enough is enough. We need national health care now. Very important. And what is it all about? What is it all about? Well, they're cutting Medicaid, they're privatizing Medicare, and what they're saying to working people, the people of this country, is you don't have a right for health care, and unless we can make billions on health care, we're not going to provide it. And that is a death sentence for the people of this country. Health care is a human right. It should not be for profit. It should be for the people of this country. So we're going to have a number of speakers here, and we're going to be marching along Market Street and then going to that great company, Blackrock, which is profiteering off of murdering people by using AI and others in these healthcare companies, United Healthcare. So our first speaker today is Anna Malino. She is a physician, past president of Physicians for National Healthcare, and she wanted to build this movement here in San Francisco nationally. So welcome, Anna.
Thank you, Steve, and thank you everybody for coming today on this unbelievable, really beautiful day to support the National Day of Action in San Francisco. So the National Day of Action started as an idea that tried to channel the righteous anger after the shooting of the United Healthcare CEO, Brian Thompson. And this anger was directed not at the shooter, amazingly, but at the victim, because it was against the insurance companies for bankrupting us first and then denying us care later, against corporations for sucking millions of our tax dollars and immiserating our lives. National Single Payer is the organization that's organizing this across the country, is a national organization that organizes locally for national single payer. We are joined by the common principles that healthcare is a human right, must be free from profit, and will be achieved through national legislation. So back in January, we wrote an op-ed that called for a National Day of Action. And this call caught the imagination of the very people fed up with the status quo. Since then, 140 local and national organizations have endorsed the National Day of Action, and over 25 cities across the country are holding rallies just like ours to commemorate and to celebrate this National Day of Action. So, it just came from a little tiny idea. Now, it is natural when we are under attack to go on the defensive. And we are under attack. Our federal workers are under attack. Our public entities are under attack. Our courts are under attack. It is natural to want to protect these, but the best defense is a good offense. And that's why we are here today, to go on the offensive, to put single payer on the nation's agenda. Now, what is the best way to eliminate impending Medicaid cuts? National single payer. What is the best way to stop imposing work requirements and insane paperwork to prove you're poor enough to deserve Medicaid? National single payer. To end the overpayments to Medicare Advantage and the privatization of Medicare that is using our hard-earned dollars that we pay every 2 weeks to our payroll taxes for our entire working life. What's the best way to end all that? National single payer. What's the best way to prohibit narrow networks, prior authorizations, delays and denials of care, insurance plans that profit from our income and our tax dollars. National single payer, thank you. And to end medical debt, deductibles, co-pays, co-insurance, medical bankruptcy, and all financial barriers to care.
National single payer.
And finally, what is the best way to negotiate at the bargaining table for higher wages?
National single payer.
All right, you guys got it. Today we are joining cities across the country and focusing our collective anger towards corporate health insurers to bring real reform. So put your hand up if you think that the recognition that you are for the recognition by our government that healthcare is a human right. Hands up. Hands up for the elimination of private health insurance and the banning of for-profit delivery of care. Hands up. The enactment of a publicly financed national single-payer program that would provide comprehensive coverage for everyone. And finally, put your hands up for the transformation of care delivery from profit-seeking ventures to service organized to serve the people of our country. A service in which all caregivers are freed from corporate control. Let's put single payer on the nation's agenda and heal this country. Thank you.
Thank you, Anna. And she's a physician. There are many physicians in this country who are fed up with the healthcare system because they want to take care of people. They want to do their job, and they're prevented from doing that by this system, which says that they can't do their job. They have to really make sure that they're making profit from the insurance company, whether you're in Kaiser or an HMO. Now, in this country, they say you can't have health care for all, but actually there is a health care program for veterans that covers them and is a plan that actually takes care of them well. And that is now under threat because these privatizers, these wreckers who are destroying this country and destroying this government really don't give a damn about the veterans. And joining us today is a leader of one of the VA hospitals, Mark, who's with the NEF, I think, and he has been fighting at the Veterans Hospital to stop the budget cuts, to stop the attacks. They have a rally every Wednesday at noon, which all of you should try to go to if you can, because we have to talk with the community. We have to talk with the veterans. We have to build a movement. So welcome, Mark Smith.
Hi, everyone. Testing this thing. My name is Mark Smith. I'm an occupational therapist, and I'm the president of the National Federation of Federal Employees, Local 1, representing frontline healthcare workers at the Veterans Health Administration here in San Francisco. I'm proud to stand with you all here today in the struggle for a national single-payer healthcare system. At the VA, I see firsthand every day what healthcare looks like when we collectively decide to put patients over profits. While it's not perfect, obviously, no system is, the VA delivers comprehensive, publicly funded healthcare for over 9 million veterans and their families every day. And despite what you might have heard from the corporate media, the care is world-class. Study after study shows that VA-delivered healthcare either matches or outperforms the private sector healthcare in both quality and patient satisfaction, and at significantly lower cost to the taxpayer. Last year, veterans' trust in the VA was the highest it's ever been recorded. But the corporate healthcare industry, our friends over at United Healthcare, and the private equity ghouls who back them, and the politicians that they've bought and paid for, hate this. They hate the VA, this model of publicly funded healthcare, right? Because it's hard to make a profit selling the idea that public healthcare doesn't work when the VA keeps inconveniently proving that public healthcare does work, right? So the corporate class is running the same playbook that with VA that they run with all of our public goods and services. They want to defund VA healthcare by siphoning off resources to the public sector under the guise of choice, right? We've seen this with public education. We've seen this with our postal service. We've seen this with all kinds of public goods. and services, and then, they degrade the services, and then they demonize the understaffed and under-resourced facilities as inefficient, right? This is all with the ultimate goal of dismantling the system so you can sell it off piece by piece for a profit. So why does this matter? Why do we care? What do we lose when we lose VA healthcare as a publicly funded good? Obviously, for the millions of veterans who depend on that healthcare because they couldn't otherwise afford to pay for it, they stand to lose that healthcare. But we also risk losing the public goods and services that VA provides that benefit all Americans. The VA trains thousands of healthcare professionals every single day who then go on to serve civilian communities. 70% of American physicians do at least one rotation at the VA during their training. The VA's publicly funded research program develops treatments that we all benefit from. The implantable pacemaker, the liver transplant, the nicotine patch, the CAT scan, the list goes on. VA has had a hand in many of these innovations that we all benefit from. And many folks don't know this, but the fourth mission of the VA is to back up the civilian healthcare system during times of national emergency. So we saw this most recently with the COVID pandemic. VA provided medical support and emergency services in 38 states during the COVID pandemic when the private sector healthcare system was overwhelmed. No private system is going to provide all of these functions because they don't generate profits. But most of all, if we lose the VA, we lose one of the best functioning models we have in this country of a publicly funded healthcare system. And we're all here today, presumably, because we share the belief that healthcare should serve people and not shareholders. But a belief is not enough. Did working class veterans get publicly funded VA healthcare benefits because they asked nicely? No. Veterans got VA healthcare because they fought tooth and nail for it for decades. So we need to do that as well. We need to fight for the VA. We need to fight for Medicare. We need to fight for Medicaid to defend what we've already got. And we need to fight to expand for Medicare for all, for a national single-payer healthcare system. And we need to fight for healthcare as a human right, for veterans, for workers, for everyone in this country. Thank you. Solidarity.
Thank you, Mark. And as I said, they are rallying, marching out, speaking out every Wednesday at noon at the VA hospital in San Francisco. So if you have a chance, join them, show solidarity. We're all in this together, and we got to support our vets. We have to support the workers at the Veterans Administration. Thank you, Mark. As everyone knows, here in San Francisco, we were the center of a struggle against AIDS in this country. And the same people who are running this government actually did not want to even investigate what the causes of AIDS were. They blamed gays, they blamed lesbians for a disease. And this struggle here in San Francisco to fight AIDS and defend the people who had AIDS saved lives. And now with the cuts that they're talking about in Medicaid and Medicare, people are going to die today because of these cuts. So we're talking about murder. That's what we're talking about. These people are going to murder people for profits so the billionaires can have more profits. That's what this is about. We got to stop it. So our next speaker is Harry Bro. He is a member of the Senior Disability Action, and he has been fighting in Senior Disability Action for all seniors. And seniors are definitely going to be hit in the nursing homes and many other areas. So welcome, Harry.
Hello, Bay Area. Look at all those smiling faces. Wonderful. Thank you. Is the mic working? Yes. Can you hear me? Can you tighten it up? Get closer? Get further? What? How's that?
Get closer. That's good.
Right here?
Yeah.
There we go. Thank you. All right, I'll read it to make it simple for me. And I am a long-term survivor of AIDS, positive since 1980 and full-blown AIDS since 1996. I am a miracle walking here because of the medications that were provided and paid for by Medicare programs. So I'm clear what I'm talking about on that one. I'm Harry Bro, and I'm speaking on behalf of the members and staff of Senior and Disability Action. We do not support any cuts to Medicare or Medicaid and demand that Congress reject these devastating and deadly actions. Nothing good can come from privatizing Medicare and Medicaid. Government's primary responsibility is to protect all its citizens, not just the billionaires. Congressperson Deborah Ross of North Carolina said it this way: this administration should stop violating the Constitution and start taking care of people. To participate in our country's pursuit of happiness, the people need health care that gives each person the opportunity to enjoy excellent health. Our government is failing us in this. Our health care system is broken. President John F. Kennedy proposed a plan to provide health care for the aged, which eventually became Medicare. But in 1962, President Kennedy's legislation failed because it was branded as socialized medicine and a threat to individual liberty. We reject that claim. Single-payer health care is not socialism, it's humanism. When your neighbor is ill, you care for them. Government must be our good neighbor and work to heal us, not offer empty rhetoric. We demand national, publicly financed, single-payer health care that eliminates the current for-profit, capitalistic minefield. Medicaid and Medicare cuts will devastate thousands of vulnerable people who rely on those financially supported services. My own Medicare Advantage health care would be devastated by the proposed cuts, and I could lose my life. As a person with AIDS, without those outrageously expensive medications, I would face a slow and painful death sentence again. We demand all members of Congress publicly support Medicaid and Medicare for all. At every opportunity, at hearings, at town halls, and in forms of media, pressure your senators and representatives, call and tell them that cuts to Medicare and Medicaid are not acceptable. Remember, our government has the constitutional duty to protect its people. Put single-payer health care on our nation's agenda now. Get for-profit plans out of our health care system. Thank you.
Thank you, Harry. And as he said, this is a life and death issue in this country. And I want to reiterate, 3.4 million Californians will be losing their Medicaid. Where are they going to go? Where are they going to go in this country? If you don't have Medicaid, you die. And this Governor Newsom, who said he wanted single payer, wants to attack immigrant workers who do the work in the fields and say they have to pay for health care. Outrageous, outrageous. The workers who are doing the work, they're going to charge them and throw them off Medicaid? That is a crime. That is a crime to throw people off of Medicaid, really. They need it for themselves and for the people of this country and the state. So our next speakers are Rocio Rodriguez and Ligia Montana with testimonials. So welcome both of them.
Hi, mi nombre es Rocío Rodríguez. Soy Rocío Rodríguez, vivo aquí en San Francisco por 33 años. No es justo estas leyes que están pasando cuando nosotros todos luchamos por tener todos los servicios y los beneficios que había. No es justo que solamente se estén enfocando a las cantidades como de 2,000 y 3,000. ¿Cómo va a ser posible que vivamos con un sueldo o con una ayuda de esa magnitud? No es posible viviendo en San Francisco, donde la vivienda y todos los servicios son más caros que en otros lados. No es justo que la gente que está arriba, por la cual nosotros un día la elegimos para que estuviera en donde está, a hoy no nos echen la mano. A hoy que necesitamos, a hoy que somos ya personas de la tercera edad, con disabilidades. Me voy a traducir. Her name is Rocio Rodriguez, and she said that it's not fair that now they are focusing on, reinstating the asset limit, which is $2,000 for, to apply for Medi-Cal in California. You can only have $2,000 in assets and as an individual, and $3,000 for a couple. And so it's not fair that people that have been working so hard for the benefits, for all the stuff that we have won in here, now is not going to be able to get those benefits. And especially here in San Francisco, it is a city that is very expensive, and so she says that it's not fair that they are trying to put those asset limits.
Vamos a seguir con nuestra lucha porque somos fuertes como lo fuimos en el pasado. Hoy nuestras convicciones, nuestra experiencia que hemos tenido, la tenemos que seguir conservando, pero sobre todo que nos sigan respetando aquí y donde quiera como gente de la tercera edad, gente que podemos hacer el cambio. ¿Por qué? Porque estamos aquí todos los interesados, somos la voz de los que no pueden estar en este momento con nosotros. Sigamos adelante, compañeros. Gracias.
I guess most of you are bilingual because you are clapping before I translate. Sorry. So Rocio said that it's about being respected also, and it's not good that the government is doing this. They got elected to do a job and they're not doing it, and so but together we're strong and we can continue fight because this is the fight that we need to do at this moment. So I'm paraphrasing, okay, because she says a lot. But this is, the fight, the moment to fight. And so, and she said that together we can. So, ¿se puede?
Sí, se puede.
Okay. All right. And she said thank you. Okay. My name is Ligia Montano. Yeah, she said it already. Okay. So my name is Ligia Montano. I'm with Senior and Disability Action. We are Senior and Disability Action are really worried about what's going on at the federal level, but also in California, what we're seeing. Because a lot of our members cannot really afford to pay out of pocket, all the healthcare, costs that they trying to impose on people. And so if we know in California, if they pass what they pretend to pass, right now with the asset limit, about 40% of the people that are now enrolled in Medi-Cal will lose it. And so do you think that's fair? No. And they are bragging about being the fourth economy in the world. They're bragging about that, and they're cutting the people that needs the most. This is so unfair, right? Shame on them. And so for us at Senior and Disability Action, we wanted to support our members. We wanted to support our communities. And so for us, it's really important that we get involved, that we are active, going to Sacramento, going to, federal buildings to protest these cuts. And so if you wanted to get involved, we have our members, of the big coalition here, passing around a little flyer with a QR code. Is that how you say it? Yeah. So please,
we're not gonna sell your information. We just need you to get involved and fight with us because it's necessary. And if you wanted to win, you have to know that the only way of winning is by organizing. We have to organize. We have to, say no to those cats, not only for the federal asshole that we have, but also for the state asshole that we have. Yeah. And so, what do we want? And when do we want it? Now. Thank you.
Thank you. So let's say that again. What do we want? When do we want it? Now. What do we want? When do we want it? Now. David Campbell, Jewish Voice for Peace. Before he gets up, one of the things in this country that is absolutely crazy is that we have the biggest military budget in the world, over $1 trillion for bases, over 800 bases all over the world, but we can't afford a national health care system? That's an outrage. These people who vote for this budget are killing people in this country by not funding health care. They say there's no money for health care, but they've got billions more for what the genocide we're doing, the Israelis are doing in Gaza. Shame! 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 The money that's being spent to bomb hospitals, to bomb schools in Gaza is an attack on the working people in this country. It's an attack on every person in this country. We have money for bombs, to kill people, to bomb hospitals and schools, but no money for people who are dying here because they can't have health care. That is an outrage.
Hi. 2 quick comments. First, Steve just stole all my thunder. Second, Jewish Voice for Peace has endorsed this event. However, I am not speaking on behalf of Jewish Voice for Peace. I am speaking only as an individual. Okay? So, with that said, got to get to my notes here. I'm going to talk about what I think how we need to be framing our message. Okay? So, freedom. Freedom is the value upon which this country was built. Freedom is something that everybody in this country espouses. Yes, we've got different interpretations of freedom. I mean, you just have to look at the Freedom Riders versus the Freedom Caucus, if you want to look at the Freedom Caucus. And we all have, though, an innate knowledge, an innate understanding of what freedom implies. The Declaration of Independence clearly says that everyone has a fundamental right to safety and happiness. And that means not only the freedom to enjoy those rights, but also the obligation to oppose actions that impair those rights. In the framers' words, we must have freedom from tyranny. And as we all know right now, that freedom is under a lot of threat. We must have freedom to act, but even more so, we must have freedom from that which undermines our safety and our happiness. So what has all this got to do with health care? For periods of time, I've lived under the healthcare systems of Canada, Great Britain, France, and the United States. I'm familiar with how each functions, or not. As such, I'm reasonably well placed as a healthcare consumer to comment upon these systems. Sorry. Comment upon these systems. It's important to note, though, that what we're doing here, what I propose, is not focusing on the healthcare delivery system. Yes, that's broken. Yes, that needs to be fixed. But first of all, we need to get universal access to that system. So be careful of what our opponents are saying. They will criticize delivery systems elsewhere. Does Canada have a capacity problem? Yes. Is British NHS falling apart because it's been starved for funds by successive Conservative governments? Yes. Does France have a problem with distribution of their resources? Yes. But each one of those countries has 100% universal access to their systems. Their focus is on fixing the systems. Our focus is on getting access to those systems. Well, I'm going to come to that. We cannot be free if we face the debilitating effects of injury and disease. We can't be free if a health condition leads to bankruptcy. We cannot be free if privately driven insurance companies control our healthcare system and put profit ahead of people. We need access. Access now. Yes. Yes. So, we can't sit around and wait for the light bulbs to go on in Sacramento and Washington. They haven't done, and we need, as another speaker has said, we need to organize. We need to work together collectively so that our individual health and safety is protected. So this is a collective action to promote individual health and welfare. Our argument will not be won with arguments that only appeal to reason, like the statistics do. I'm not talking about statistics. I mean, we all know that Canada, Britain, and France spend far less per capita than the United States does on healthcare. We also know that the outcomes are far better. Those don't win our arguments. We've been saying that for years. We all know that economics analyses demonstrate just how much we will save financially. But that doesn't win the argument either. Unfortunately, should. And no matter how long we shout it, if we only talk about healthcare as a human right, it can be dismissed. Everybody can claim something is a human right. Healthcare is a human right. But we need to do more. We need to appeal to a value that everyone in the United States shares. And that value is freedom. Universal access to healthcare will bring us freedom. Freedom. And another important point is that, and Steve stole my thunder on this one, but that's okay, it's worth repeating. Healthcare lack of freedom exists elsewhere. You can't be free when your hospitals are being bombed. You can't be free when your doctors are being killed. And you can't be free when your people are starving. Our healthcare security here is inextricably linked to the security of Palestinian people. We spent in this country over $18 billion last year on aid to the genocide against Gazans. If that money were directed rather towards providing universal care for Americans, everyone would be better off. We would be freer, and God knows the Palestinians would be freer. Okay? So, our freedom and the Palestinian freedom are linked. Okay? And this is why all progressive people need to work shoulder to shoulder with other progressive organizations, whether it's Movement for Black Lives, whether it's LGBTQ, whether it's the Palestinian Solidarity Movement, whether it's health care for all. We need to work collectively because the key word is solidarity. Okay? So, I'm going to put on my keffiyeh. Okay? I'm going to proclaim my belief in a free Palestine, and I'm going to do it proudly and happily. All right? So, join with me in this chant, if you will. I'll say it once, and then you can repeat it after me. U.S. government, you can't hide. You're complicit in genocide. You can't hide. You're complicit in genocide. Thank you.
Thank you. And they are connected. What happens here in San Francisco is connected to people in this country, in this world. We are one people all over the world. And health care is a human right for all. Every person in this world should have health care. And we have the money to do it. That is the sickness of this society. All the billions and trillions spent on warfare and war profiteering is preventing you and I and others around the world from getting health care. So it's a system that we're talking about that we have to confront. Now, we can't have a rally without some music, and I know that Trump and these gangsters and fascists running the government don't like some of the musicians for some reason. The musicians are a threat to them, and they're attacking them. But actually, I think that's a good thing, because the musicians will use their music and their art to get the truth out about what's going on. So our next musician is Jimmy Kelly. He's a labor troubadour and a member of the American Federation of Musicians. Welcome, Jimmy.
Thank you. There's a real war going on. It's a culture war, and if we don't fight it, we lose. Now, this is a song. It's based, written by Lee Burkholder and Vicki Ryder. I need your help. It's called "Standing in the Need of Single Prayer." Pardon me. It's a takeoff of the song "Standing in the Need of Prayer." So the chorus goes like this: "We will rage and shout for single payer for all, everyone in and nobody out, single payer for all. So it's your father and your mother and the uninsured, standing in the need of single payer." Can you say that? After my verse, you do "standing in the need of single payer." So it's your father and your mother and the uninsured, standing in the need of single payer. It's your sister and your brother and the uninsured, standing in the need of single payer. We will rage and shout for single payer Medicare for all. Everyone in, nobody out, single payer Medicare for all. From your birthday till you're buried, you will get good care when we have a single payer plan. If you're married, single, gay, or straight, you'll get good care when we have a single payer plan. If you're hired, if you're fired, you'll still get good care when we have a single payer plan. And From retired to expired, you will get good care when we have a single payer plan. Well, there's no premium deductible, no copay when we have a single payer plan. Doctor's orders are for health, not for our corporate wealth, under a single payer plan. Who will pay for it, you ask us? We will pay through our taxes. That's the way to get the health care that we need. And the costs will all be fair, and the funding will be there when we banish inefficiency and greed. That's the insurance companies. Corporations that insure us don't do anything to cure us. We need a single payer plan. We are needy cause they're greedy, so let's throw them out and demand a single payer plan. Thank you.
We have to sing out. If we're going to get the voice of people, we need the musicians. So our next speaker is Corinne Frugoni. She's with Physicians for a National Healthcare Plan. Welcome.
Thank you all for coming. And I want to say there's 5 of us from Humboldt County. We drove all the way down because we are for single payer. And I'm also a member of HCA, so I want to say, you know, a good clap for everyone here. So I'm going to start by making an assumption. I probably shouldn't make assumptions, but I'm going to. I think some of you are on Medicare. Am I right? Yes. And I'm here to talk about the privatization of Medicare, which is happening in front of our eyes. That's right. Medicare started under LBJ. It was meant as an insurance system for all people 65 and over and certain people with disabilities. It was a first step. It was only meant to be a first step. It was meant to start a movement to provide improved Medicare for all. And we're still a little behind the times here. But I'm here to say, instead of us getting Medicare for all, we're having Medicare piratized by middlemen who are for profit, who want to extract money out of our Medicare trust fund. And they are overbilling Medicare by and this was in 2020, between $12 and $25 billion. Now, that amount of money is larger than the budget of some of these individual government organizations, which may be gone in a few years anyway, but it's bigger than NASA, it's bigger than the FBI, it's bigger than the Environmental Protection Agency, it's bigger than our federal prison system. They are bilking our Medicare trust fund. How do they do that? Well, they seek healthy patients. That's why when it's the Medicare enrollment period, they go for people who are 65 because they figure those people will be healthier. And they try to drop people who have too many expensive conditions. And it's called lemon dropping and cherry picking. They also limit care available for very expensive conditions, and they do it in very underhanded ways. So they try to get sicker patients to leave because sicker patients cost more money. They limit the network of doctors and hospitals where patients can actually choose to go. They don't cover hospitals that are set up to cover the most expensive care, and they don't cover very expensive medications. Now, how much are these middlemen for profit taking over? By the way, it's called Medicare Advantage. And some of you might be on Medicare Advantage. I don't blame you. It looks a lot cheaper, but it is good for people who stay healthy. Be careful if you get really sick. I myself am on traditional Medicare, but I'm at risk too, and I will get into that shortly. But anyway, how much do these private for-profit middlemen bilk the Medicare Trust Fund? The Medicare Trust Fund has $1,000 billion in it. I had to look up what $1,000 billion is. It's $1 trillion. So there's a lot of money that they can extract out of the Medicare Trust Fund. That's Medicare Advantage, but of which about 50% of seniors are now enrolled in Medicare Advantage. That leaves about 50% of us who are not, but they're going after us too. It's just too lucrative. So there are new programs called ACO REACH. REACH stands for Realizing Equity and Community Health. It's a lie. And at least with Medicare Advantage, it's insurance companies that are taking the money out. They pretend to be interested in health. ACO REACH, it is private equity, have no interest at all in health care, health justice, access to health care. No interest at all. They just want to extract between 25 and 40% of profits out of their investment in health care and then drop it after 7 years. And unfortunately, the whole system, as we all know, is only getting more and more complex. And here's an example. Since 1970, so from 1970 to now, it seems like a long time ago, administrators have increased in number by 4,000% to run the system. How much more have physicians increased, percentage-wise? Maybe between 50 and 100%. We don't need more administrators. We need more physicians. We need more nurses. We need more therapists. We need people who are taking care of the hospital. We don't need administrators. So once again, how do these new programs make money? Same way, they maximize revenue from Medicare. They're just extracting the money. There won't be money left. They minimize revenue for patient care. Let's see how we can deny care. That's what they're very good at doing. And they try to enroll as many beneficiaries as possible. So Medicare Advantage does a lot of advertising, but these new programs do it more stealthily. They know, they go and buy up physician practices. They look at the patients that are being seen. They go through their records and they say, oh, Corinne Fragoni is on traditional Medicare. We're going to enroll her in our program without telling her. And then they'll send me a letter and saying, you are now lucky you're going to be in an ACO REACH program. And I go, I don't want to be. And they say, sure, you can leave, but I live in Humboldt. Where am I going to go? There's no other physicians around. So we're stuck. This is what's happening in front of our eyes. So privatization overall, it threatens Medicare solvency. It kills people. But I have an interesting thing that I just found in the news, and we're going over to Blackrock, which I hope all of you come together, because that's where we have the strength. And I'm going to read you the headline. Blackrock, which is the largest asset management company in the United States and owns nearly 10% of United Healthcare. How many of you have heard of United Healthcare? The worst of the worst. BlackRock is suing United Health for providing too much care to patients following Brian Thompson, the CEO of United's murder. They actually went after United, which is, it's like one evil organization going after another. Let them fight it out. Let the Titans fight it out. I hope they destroy each other. And it goes on into investment giant BlackRock has filed shareholder lawsuit against United Health Group, alleging the health insurance provider is providing too much care to insurance holders and approving too many claims. So let's, after we finish here, let's all march over to BlackRock and show that we are not going to stand for it anymore. Single payer for everyone.
Thank you, brothers and sisters. What do we want?
Single payer.
We're here in San Francisco, which is one of the wealthiest cities in the world. There are over 80 billionaires in San Francisco. 80 billionaires. And yet, the people of San Francisco can't afford health care? What the hell's going on? And the black community, black and brown community, are at the center of this healthcare crisis because the people of Hunters Point, Bayview, and Treasure Island need healthcare because those are contaminated radiation dump sites. And they've been poisoned for decades. And what does this city say about it? There was a hearing that they had, and the Department of Public Health said they don't know who's been contaminated. They don't know who's sick. What is going on with our health department in San Francisco? They're responsible for the health of people in this community, yet they don't know what's going on with the residents and the workers of Hunters Point. That's a crime. So our next speaker is Ariana Harrison, and she is an activist. Her mother died, and there's a foundation that she's been working on, and she's been fighting for health care and human rights and justice for all the people of Hunters Point, all the people of this country. Welcome, Ariana.
All right, you guys. My name is Ariana Harrison, and I am the Executive Director of Marie Harrison Community Foundation, located in the southeast sector of San Francisco, District 10. What I'm here to tell you, the message that I am here to deliver today, is that there has been a tragedy that has happened in District 10. It's been going on for a very, very, very long time. I believe that you just said you talked to the health department and they don't know why people are sick. Well, I'm here to tell you, as a medical professional, there is something called biomonitoring. Biomonitoring is when you test a person's urinalysis tox stream testing to see what kind of radioactive isotopes and all kind of different elements that they have in their system, okay? And the reason I'm bringing that up is because all the evidence that they need, that community has been systematically poisoned, is to test the human beings that have actually been there for decades, for generations. We can't continue to have willful ignorance around the disproportionate impact of pollution and toxic chemical waste on human beings. And let me tell you something. It's usually concentrated in black and poor communities of color, and that means all people. You can look across the USA, and wherever there is an overload of toxic and chemical waste, is where people live at that are extremely poor and probably poor educated about the things that are happening and transpiring in their communities. But one thing that we all know, you know when you're being treated right? Okay, does everybody agree that life is precious? Yes. Does everybody agree that we need to secure a future for our next generation coming behind us that doesn't have to beg for clean air, water, and land? Yes. Clean air, water, and land is a human right, correct? Yes. Okay, so I'm gonna fire you guys up a little bit, and we're gonna start with a little bit of call and response. So when I holler at you, I need you to holler back at me. I need a little motivation this morning because I'm very sad. So when I say can you say live, can we? Live. When I say can you say live, can we? Live. When I say can you say live, can we? Live. Keep that in mind when you guys are doing a good fight. All people's lives matter. All people's health conditions matter. The number one killer of finances in the whole entire USA is medical at the end of the day. Yep. You know, it doesn't matter what background you come from, what your income base is. I'm telling you, medical care, when you start to get older, is going to eat up your funding and whatever you may have left during this administration for retirement. Some of us will never be able to retire. Some of us will never be able to take that family cruise that we always thought about doing because we have lived on a hamster wheel forever. Forever. They telling us that we have to work until the day that we die. The day that we fall out. That is crazy. That is crazy, folks. So I'm here to tell you guys there is a way to win this. It's all of us or nothing. We need your help. We need for the city of San Francisco to stop ignoring the southeast sector of San Francisco. We need for the city of San Francisco to stop ignoring the fact that people, human beings that is, have been exploited, have been marginalized, and have been isolated from the rest of the San Francisco. And it's not just a Hunters Point southeast sector district issue. It is a San Francisco issue, and it's up to San Franciscans to stand on that and stand on business and make a difference. That's right. My name is Ariana Harrison. I approve this message, and I'm out.
Thank you, Ariana. Now, another important group of people that are helping us out every day in this country are home care workers. Because people need home care workers. We have an aging population. And these home care workers, and there are 400,000 in California, they are themselves suffering because they're paid not a living wage, they're paid a bare minimum wage. And there's a struggle every year in San Francisco to get a living wage for home care workers. 400,000, and they're in SEIU 2015. And we need to get the SEIU, which has 700,000 members in California, to get behind single payer. So all people have it, and the home care workers and the people they're taking care of in the nursing homes also take care of it. So welcome Bradley Weidmeyer. He's a member of 2015 and used to be on the Labor Council.
Thanks, Steve. I have a sign that's the baseline. Healthcare is a right. We have to build this movement. And just like the fact that the powers that be are going after the weakest in free speech and taking away our ability to speak, they start with the weaker people. And right now in this budget revise in Sacramento, Newsom is cutting out immigrants from health care. He dares it. We in San Francisco, who watched him as a supervisor oppose healthy San Francisco, he's claiming that he supported it then and that he should get some credit for that because he tried it one time. But this is what they're doing. They're going after the poorest. They're going to be charging monthly $100 per person, impossible rate, and taking people off of the health care that finally undocumented people have gained access to. And that is because they're coming after all of us. And one thing I want to stress, this is my 50-plus year in fighting the powers that be, the corporations. I grew up in the Pacific Northwest, and I watched as a kid, as the Canadians, the farmers in Saskatchewan, and the workers in British Columbia built a workers' party, the New Democratic Party. And they didn't get the single-payer system in Canada until they had a class party that looked out for people at the bottom, those that have the least right to speak, those that have the least right for health care. It was the drought and the depression in Saskatchewan, and it was the attacks on workers on the Pacific Coast in BC that led bit by bit. And the New Democratic Party is essential to protect single payer in Canada. Because as soon as that party is weakened, and we saw them fall from 24 seats in the parliament to 8, but where were people going? They were going to block the Trump takeover of Canada and the far right. Those people still support this party. And there are provinces that are ruled by this party, and every time people start to go after single payer in Canada, the New Democratic Party surges because we can't rely on the classes of the conservative, i.e. Republican here, or the Democrat, or the liberals in Canada, i.e. the Democrats here, because they don't look out for everyone. They're seeing who they can cut out so that the people they serve can make more money, especially in a crisis. And now we've seen the billionaires completely take over our government. Look even at the DCCC in San Francisco. That's why we need a workers' party, a labor party, a party of the communities. We must have that to move forward because it's not in their material interest. We're the first to be cut. We need to have a strategy, a political strategy of independence. And we need, right now, we saw Trump attacking the courts front on, and then the Supreme Court buckling once again after Trump called Leonard Leo and the Federalists a sleazebag. These are the far-right judges that he's put in there. He's threatening to either take down the judiciary and go the next step with a phony Reichstag sort of provocation so we can have emergency rule. But the best defense is a good offense. We need to build a class political movement in this country right now. We need to form committees in our neighborhoods, every library meeting, every corner of the city needs to have a council We need to build and demand that these cuts not come through. Home care is going to be cut. Our wages are going to be cut. Our overtime is going to be cut out. Transportation is being cut. They want to take us back to a lower wage that can't sustain the home care workers in San Francisco and the metropolitan areas. We have to stick together or we're all going to hang separately. Fight! Workers' politics!
Thank you. We're going to ask the speakers if they can limit their speakers, because I know people want to get going to this march to Blackrock, and we also have a band, the Brass Liberation Band, which is going to lead the way. So thank you to the Brass Liberation Band for joining us today. We need music. We need music. So our next speaker is Ed Kinchley. He's president of SEIU 1021 West Bay Retiree Branch.
I'm happy to join to follow an SEIU brother. My name is Ed Kinchley, longtime member of SEIU 1021. I was chair of our healthcare industry for the local for a long time, and right now I'm chair for our retirees here in the West Bay. I'm here to tell you that SEIU 1021 is 100% in favor of single-payer health care. And I think a big part of the reason that we have moved in this direction as a union is that many of our workers, thousands of our workers, work in healthcare. And those of us who work in healthcare know that the current system is not working. And it's particularly not working for working people, for the poor, and particularly for people of color. I think our union and other unions must do more to participate in this movement to win single payer. And I can tell you that the way that we started in SEIU 1021, so we started as an independent committee that had no acknowledgement from the local. Then we eventually got acknowledgement as a committee within the local. Then the next step was we then got them, the whole local, to take a position in favor of single payer. And eventually got our international to also take a position on paper for single payer, even though any of you who know anything about the labor movement know that SEIU nationally isn't doing anything for single payer. And then on the local level, we got our local to actively support specific pieces of legislation, particularly here in California, for single payer. Right? That's sort of the process that we went through. We find and appeal to people in the who work in healthcare, and also members whose family and who themselves have been forgotten by the healthcare system in terms of not having their medical needs taken care of. I personally worked as a social worker in the emergency room at General Hospital for 18 years. And every day, I and my coworkers saw how this system does not work. Many people come into the emergency room with things that they should be seeing their GP, their regular doctor, about. But they don't have a GP because they don't have insurance. A really strange system, and one that not only is not economically good for us as individuals, as families, as communities, it's not good for the nation. We spend way more money because we don't take care of people with preventive health care, just keeping people healthy. That's what we should be doing, and that's what single payer would be able to do.
That's right.
That's right.
We need to get the for-profit health insurance industry out of the picture.
That's right.
From our perspective as healthcare workers and as people who receive healthcare, we know that the healthcare insurance industry does not provide any healthcare. In fact, their objective is to limit or to deny healthcare and access to it. And these days, they've started using robots to do the denials. Of course, the robots are programmed by them to do what they do, so it's not like there's independent thinking there, but they're keeping up with IT to do a better job of screwing us.
Taking jobs away from everybody else.
And of course, you know that United Healthcare is one of the worst of these for-profit, not-for-people insurance agencies, insurance industry. Of course, we have to stop the cuts in Medicaid, Medicare. The cuts in Medicaid in particular, I believe, will be a death sentence for many people. We had at least one speaker speak to that earlier. We have to stop those, but we have to do better. Like many people have said already, a good offense is the best defense. I also want to invite people. This Wednesday, our union and other city worker unions are holding a rally at noon on Wednesday at City Hall prior to the 1:30 budget committee hearing, at which the mayor's budget, which includes a lot of significant cuts, including in healthcare, I invite people to come and join us. I just want to close by saying, I'm going to say health justice. I'm going to ask you to say single payer. Health justice.
Single payer. Thank you, Ed. And one of the groups of workers in this country that have been struggling against privatization, attack on what they do, is the post office. And everyone remembers the struggle against privatization to turn the post office over to Staples. Do people remember that? Yep. Go to Staples and you'll get your meal. That was fought by APW, American Postal Workers Union, and they're here today to talk about the struggle for single payer and for their members and all people. And joining us is Alice Lindstrom from the APW, a retired postal worker. Welcome, Alice.
I am sent by the American Postal Workers Union San Francisco local. I am a retired, but I'm a member of the executive board, and the executive board wanted to send their support and solidarity to healthcare for all. We are on record for many years as supporting single payer healthcare for all. We don't like the name single payer too well because it takes so much explanation. But anyway, in our national is also in favor of healthcare for all, and actually the AFL-CIO, with the little wording problems, is also in favor of it. And I think probably most of you know that the reason that unions are so crucial in this thing is that unions started having a stake in healthcare back during World War II when there were wage and price controls. And so when they came to negotiate, they could not negotiate wages and prices, so they negotiated healthcare. And some of the healthcare that was negotiated by some of the unions was so wonderful that they started using it as the main reason why they thought people should join their union. And this caused a reluctance for them to embrace the rest of the labor movement and the society's need for everybody to be in the same boat. But the times have changed. They're now finding, those unions are finding that they can't the amount of money that's spent in the negotiation for their health care is impeding their needs for negotiation for the other important things, safety, salaries, everything. So now it's time. This is the time that that we can all get in the same boat. The critical mass time has come. The labor movement, more of the labor movement, is in favor of national health care for everybody than ever before. And this is the time. This whole thing, one of the impediments beyond the labor movement for single payer has been people who who they don't quite qualify for the programs that we have because they make a little bit too much pension to get Medicaid, but they can't afford health. They can't afford the caregiving that they need, and so they're sort of jealous of the people who make a little bit less but get full-time caregiving or almost full-time caregiving, but they can't afford it and they can't get it. So there's a jealousy of the people that make a little bit less, and I think this is one reason that they're getting away with, to a degree, cuts to Medicaid, because there are people saying, well, why do they get it when they seem to be living better than me? Well, the solution, the divide and conquer is true, but the solution is for all of us to be in the same boat. And this is the time to get in the same boat and not be waylaid like we've been waylaid before by being told things like HEPA is a good solution rather than Medicare for all, or Medicaid for all, or single payer. Or then when people finally realize that that's being shoved on them, that then they say, Obamacare, what became Obamacare, was the best that could be done. I don't know. Possibly now that we see how much of the country is worried about things like health care, like money, and getting security. Maybe it was. I don't know. But I do know right now that this is the best time we've ever had for to be united and all get together on it. So maybe in honor of Don Beckler and all the work that he's done, and so many of us have been involved in all these years, let's do the chant two times. Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out. Thank you.
Our next speaker is Kathleen Healy. She's an MD, Physicians for National Healthcare.
Hey, thank you, everyone. I'm Dr. Kathleen Healy from Napa. I'm an ear, nose, and throat specialist and a member of PNHP, Physicians for a National Health Program. Is this good, sound-wise? All right, thank you. It's so gratifying to see this response to our National Day of Action to spotlight the importance of healthcare for everyone. You have the vision of what healthcare could be and should be in our nation. And vision is what we need to break away from the broken and unjust system that is all we have known in the United States. As a doctor, I envision caring for my patients without the for-profit middlemen who cause delays in treatment, denials of care, and who substitute drugs that I have little faith in. We all deserve better. We are at odds, those middlemen and I. Their purpose as corporations is to make money for shareholders, to keep their stock prices up, and to fund expensive marketing campaigns. To save money, they withhold care, delay care, and deny care. My purpose is to keep you healthy. Their purpose is to keep their company healthy. It has nothing to do with caring for you. Delaying and denying care are not their only tactics. High deductibles and large copays benefit them and discourage people from seeking care. 14 million insured and uninsured Americans have a total of $220 billion of medical debt. The majority have debt over $10,000. And medical debt is the leading cause of personal bankruptcy in this country. The National Cancer Institute publishes articles on the financial toxicity of cancer. The financial toxicity of cancer, only in America. I have a friend from medical school whose brother-in-law moved in with her family for a while. He was a successful real estate agent in Los Angeles and insured when his wife developed breast cancer. She battled it for 10 years before she died. During that time, he spent their savings on her health care, and after she died, he sold his house to pay the remaining medical bills. He was bankrupt and homeless from medical debt. Some cancer patients even forego expensive chemotherapy and die rather than bankrupt their families. What a painful decision to make. This in the world's wealthiest country. Heartbreaking, shameful, and not acceptable. So let's imagine no medical or hospital bills. Imagine no insurance premiums removed from your paychecks. Imagine the burden of providing health insurance lifted from your employer. Imagine being free to leave your job or start a business without the loss of health care for you and your family. Imagine facing a severe medical illness without worrying about medical debt. Our vision is single health payer. Single-payer healthcare abolishes the financial toxicity of cancer treatments. It prevents the current cruelty of ending health care for millions of us in favor of tax breaks for the wealthy. It kicks out the expensive middlemen and reduces our healthcare costs. The healthcare dollar goes to healthcare and not to administrative costs, marketing campaigns, CEO salaries, and corporate profit. Our vision is healthcare for everyone. Our vision is no medical debt. Our vision is no physician burnout from admin loads or moral injury from being forced to practice less than medicine. Share this vision and let's bring it on. Thank you.
We are getting ready to march to Blackrock. Now, why Blackrock? Because they lie, they steal, they cheat. Why are we going to Blackrock? Because they lie, they steal, they cheat. Why are we going to Blackrock? Because they lie, they steal, they cheat. So BlackRock happens to be the second largest shareholder of United Healthcare, and we know that United Healthcare is the largest insurance company in this country, and they're also the largest denier of medical claims, using a 90% known error rate, AI, that they know is 90% wrong, and yet they still use it. And they are the largest scammer of Medicare, scamming Medicare, $3.7 billion in just 1 year. So why are we going to to BlackRock that owns and controls United Healthcare? Because United Healthcare, they lie, they steal, they cheat. What does United Healthcare do? They lie, they steal, they cheat. All right, now what is Congress doing about it? They lie, they steal, they cheat. They are doing absolutely nothing about it. And in fact, some of them, yes, they do sign on to the Medicare for All bill, which is fantastic, but then they do absolutely nothing after that. Nothing. It's not enough to put your name on a bill and then do nothing. But today we are here, thank you, to change that. We are here because we are going to put an end to Congress not doing anything, and an end to private health insurance and United Healthcare from sucking our hard-earned dollars. Every 2 weeks we pay into our payroll taxes for our entire working life. Well, we're done doing that. We want to put single payer on the nation's agenda.
Healthcare, healthcare, not warfare. Healthcare, not warfare. Healthcare, not warfare.
Okay, we're going to start, brothers and sisters, we're going to start our continuing struggle here for health care. And as you know, we are not going to stop. Nothing is going to stop us until we get single payer, until we get health care for all.
Yes!
Absolutely. We're just beginning. So our next speaker is Valley. She's with Workers Strike Back. Welcome, Valley.
Fantastic. Hi comrades, my name is Valley Elza, and I'm a member of the San Francisco Green Party. Can I hear from our Green Party members? And the Workers Strike Back Bay Area chapter. Workers Strike Back is a political organization led by Shama Sawan, the former Seattle City Council member who was a socialist, and others who want to organize the working class and fight the rich. We want a $25 per hour minimum wage for all workers, guaranteed affordable housing for all, and we want an end to all wars and occupations, especially the genocide in Gaza. Yeah. But most importantly today, we want universal health care, an expanded Medicare for all program, and the complete abolition of private health insurance. Yeah. If you're here today, you already know that profiting from health care leads to disastrous outcomes. You already know that the amount of money someone has in their bank account shouldn't stop them from getting their prescription or seeing a doctor for their chronic illness. People shouldn't have to choose between buying groceries or buying their insulin. Artificial intelligence should not be deciding who receives medical treatment in the name of maximizing profits. United Healthcare is currently facing a class action lawsuit for this exact tactic. Shame! Shame! Getting diagnosed with a serious illness should not be a death sentence in a country like the United States. Cancer patients should only have to worry about their well-being, not whether they can afford the out-of-pocket costs of their chemotherapy, if they can meet their sky-high deductible, if they can afford to make minimum payments on their medical debt. Did you know that 80% of people who file for bankruptcy do it in part to medical debt, and they're supposed to have health insurance coverage? Shameful. Shame. Today, we are building political power. We are building a united front to push universal health care into reality. This is critical. The ruling class wants you to believe that you are isolated and powerless. Let me turn my page. Divide and conquer, exactly. They want you to believe that you're isolated and they want you to feel exhausted and overwhelmed. But as working class people, we have so much more power than just voting every 4 years. Republicans are fighting for the rich. They are ripping away Medicaid coverage from 14 million Americans with Trump's big, beautiful bill, full of tax cuts for the rich at the expense of the working class. I don't think I need to explain to this audience how Republicans are tearing apart the federal government in the name of eliminating waste. However, the Democrats have also succumbed to corporate greed. Gavin Newsom ran for governor with the promise of enacting CalCare, a single-payer healthcare system for California. His endorsement from the California Nurses Association was entirely dependent on his support of single-payer healthcare. What did he do when he got elected? He did nothing. He did an about-face, and he abandoned the proposal. Shame. In California, we have a supermajority of Democrats in the state legislature. However, time and time again, Democrats fail to deliver on their promises. They take massive donations from private health insurance companies that guarantee the failure of every single healthcare proposal bill that gets announced. We can't trust Democrats, we can't trust Republicans, or any politician who is bought and paid for by corporations. They will never act in the interest of the working class. We must organize outside of the two corporate parties. We can't rely on any elected official to save us, but we must rely on ourselves. Today is a turning point in the fight for universal health care, where we have demonstrated the broad support that we already have. But the work doesn't stop here. We must continue to showing up to mass actions like these. And we must continue to unionize our workplaces and use our unions to achieve political demands. Most importantly, we need a call for mass strike action that will hit the ruling class where it hurts, their profits. By strategically withholding our labor, by going on strike, we can force them to concede. But we have to organize across enough sectors to deliver the biggest possible blow. So how will you take action after today? Here are some concrete steps. If you are a union member, propose a resolution in your union to commit for fighting for universal health care. Educate your fellow rank and file members and encourage them to attend mass events like these. And if you're not part of a union, and maybe if you are, join the movement. Join organizations like National Single Payer, who organize this rally and this National Day of Action. Help us grow this coalition. Join the Green Party and help us elect our first Green Governor of California, Dr. Butch Ware, who has universal health care as a key part of his policy platform. This election is coming up in 2026. You can join his campaign by signing up to volunteer at butchwareforgov.com. Join Workers Strike Back. to help us work on ballot initiatives to win single-payer healthcare across the country and help unorganized workers start their own unions. Workers Strike Back is having an online conference tomorrow, June 1st at 12 p.m. to discuss the next steps in our strategy for fighting for single-payer healthcare. We invite you to take part in RSVP at workersstrikeback.org and join us at our in-person watch party in San Francisco at the Radical Reading Room. No matter how you get involved, the most important point is that you stay involved. Stay connected with us. Keep spreading the words about these mass actions, and we can rally the entire country behind us to win this fight. Solidarity.
Thank you, Valley. And this struggle is continuing. There are going to be many campaigns for healthcare in this country. Also, I want to let people know on July is the anniversary of the San Francisco General Strike in 1934, and we actually are due for another general strike in this country against these fascists, because that's the only thing they understand. When their money stops, then they understand. And working people in the unions have the power to shut this country down, stop this fascist, stop a martial law, which he wants to have. So one of these struggles going on around health care and around public health care is going on at UC, where these regents who are appointed by Governor Newsom and formerly Governor Brown are union busters. And they want to terrorize the students, they want to terrorize the faculty, and they're firing workers who are speaking up, and also they're trying to crush the unions. And we have with us Lisa Milos, her committee, up-team members for Palestine is supporting this struggle. So welcome, Lisa Milos.
I'm Lisa Milos, or also Elizabeth Milos. I'm a member of University and Professional and Technical Employees, but I'm speaking for UPTE members for Palestine. The University of Professional and Technical Employees belongs to, is a statewide union that is part of the Communication Workers of America. And I'm a medical interpreter at UCSF. We've been dealing with lots of issues, but one of the things that I want to say is that we've had to go through already 5 single day or triple day strikes in regarding our contract, right? One of the main issues that many unions face in this country is that many times these contract negotiations get completely sabotaged because of the fact that we also have to fight for our health care. UC is basically trying to take away the cap on the cost of health care, and that is affecting all of us. It's affecting us as patients and also as workers. How is it possible that we are healthcare workers and have to pay for health care, for God's sakes? I also want to say that healthcare also includes dental care, which is really, really bad in this country and really, really bad in most union-sponsored plans, employer-sponsored plans. And dental care should also be considered as part of it as well. I want to say also that I'm Chilean American, and we had other speakers at the other side talking about the examples of healthcare in other countries and how other countries are able to do healthcare. However, we don't look at the disasters that have occurred in other countries where healthcare was almost completely privatized, such as in Chile, which was used by the Chicago boys as a template for what they're doing here in the United States. The template being is that they don't care if you die before you even get your friggin' appointments with specialists. They don't care. People in Chile are basically getting calls for their scheduled appointments to the family members at the wake of their funerals. And that's what's facing us here. We're facing a major national healthcare disaster. We have a very large baby boomer population, and as many other people said, it's not only the elderly, but young workers in America, in the United States, do not have adequate healthcare. They many times go for years without being able to get adequate healthcare, or they have to wait in emergency rooms for hours in order to even get seen on an emergency basis. Young workers are also postponing having children because they can't afford it. There's something that we need to also talk about. We need unions. We need people that are in our own unions to actually confront our union leaderships and say, we need single payer. So I, together with another member of UPTE Members for Palestine, Anita Nuktelain and Gian Smith are running as UPTE Members for Palestine for the Communication Workers of America delegate convention that's going to be happening in August, and we're going to be pushing for this. Now, I'm mentioning Palestine, why? Well,
there is such level of intersectionality and corruption. UCSF is basically investing $163 million in Blackrock and allows Blackrock to manage its assets to the point of $2.1 billion. Blackrock also is a very important real estate company, and the real estate companies are also attacking workers at the hotels, where they're also denying health care as well at for hotel workers in San Francisco, which was something that was part of their ask and in their demands. What also I'm talking about, the reason I'm talking about Palestine in particular is because there seems to have been money available to pay billions of dollars to Israel while it was bombing hospitals. We've already mentioned that, but few people understand the level of complicity that exists within our own UC system. UC's main or very large funder happens to be the Helen Diller Foundation, the Cancer Foundation, the Helen Diller Foundation, which supports Israel, supports the IDF, and also is supporting Canary Mission, which is attacking faculty and students and calling them anti-Semitic for protesting genocide. So we have a lot of intersectionalities here. We're not only talking about the healthcare of our people here in the United States, we're talking about the healthcare of humanity, the healthcare of the earth. That's what we're talking about. Also, by having single-payer healthcare, we would also be able to help workers who are injured. I was also an interpreter for workers' compensation, and it's incredible the level of workers who undergo serious issues where they become addicted to painkillers because they cannot find adequate health care for their injuries. We're also talking about black and brown communities and poor communities across the United States that is facing environmental pollution, environmental attacks on their communities. There's clusters of communities where they have been getting asthma here in San Francisco, asthma in Bayview's Hunters Point, as well as what Steve mentioned before, radiation from super sites. So our country is sick. Our entire system is sick. We need single-payer healthcare. We need Medicare for all, and we need to disrupt and to completely take down these billionaires that are not elected at the UC regions in particular. They're not elected, and we need to make sure that every single congressperson that we talk to does not receive any money from insurance companies. Otherwise, there is a serious conflict of interest. Thank you.
Thank you, Elizabeth. This company here, Blackrock, that we're at, is profiting from murder. They have 8% of their stock in United Healthcare, and they want to use AI to take away our healthcare benefits. That's what they're doing. They're also profiting from killing people, and one of the things that's happening today in Pittsburgh is that there's a rally, and residents of East Palestine who suffered a derailment by Norfolk Southern are without health care today. Can you imagine that? There's a derailment caused by Norfolk Southern, and these people have lost their health care? That is an outrage. So they are rallying at the law offices of Norfolk Southern in Pittsburgh, joining with us today. We have to build a national movement of people throughout the United States. So Barbara Cummins is going to be here, and then Solomon, and those will be our speakers. So welcome, Barbara Cummins. She's a retired nurse and one of the organizers, and she met me, and we met at the protest at J.P. Morgan rally, healthcare rally for more profits from healthcare. Welcome, Barbara Cummins.
Hi, everybody. I am so happy to see all you people here. This is the first action. This is the first action we've had in several years, and I think it's been so successful. Thank you all for being here and for all the hard work from Anna.
I always say like an ice cream.
Like an ice cream, okay. All right, so I'm here today. I'm a retired nurse, and I got started in this because I had an asthma patient die in the middle of the night. He couldn't afford his inhaler. Nice. Right? Yeah, that happens, and it's still happening. Now I work with seniors, and they can't afford their inhalers. So here we go. Okay, is that better?
Yeah.
Okay.
This might be
Okay. All right. I could probably just do it without.
This one is less heavy.
Yeah, okay. How's that, everybody? Good?
Do you want to put up the volume?
Okay.
Let me put up the volume a little bit. Okay, try that.
Yeah. All right. How's that?
That's
good.
Yeah.
Okay. So anyhow, I'm here to talk about money. And there are things you can do to help with this big problem. California is one of the worst for campaign finance money. Gavin Newsom has taken $3 million from the health and insurance industries in the last 10 years. That is the same. That is more than the whole state legislature in Colorado. One person versus the whole state legislature. So, I'm here to tell you, first of all, about money on Wall Street. And this is a new thing in the last 10 years, okay? If we step aside here, I'll show you this graph. Okay, here's the graph. You can see that? It started to go up in 2014. And what happened in 2014? The ACA exchanges opened up. Okay? The exchanges opened up. Passed in 2010, they opened up in 2014. People with pre-existing conditions had to wait those 4 years to finally not have that burden on their access to health care. Isn't it a shame in the wealthiest country in the world that they couldn't have given it to them right away? Okay? So it started to go up with that, and people turning 65 at the rate of 10,000 a day. Since 2011 to 2029. Plenty of healthcare business. And what do you know? Healthcare became a commodity on Wall Street. Thriving. Okay? Thriving economy. The lines that you see here, the red lines, they suggest the volume of business. And you can see before 2014 there was very, very little in red lines. Okay? So, that went on. Everything can be profit, but not healthcare. We're getting into something called vulture capitalism, right? We don't want that. Nobody wants that. Okay, so anyhow, what can you do? As an individual, you can, if you have a 401k, find out if there's healthcare in it and how much. And then think about getting in touch with socially responsible investment person to talk to about putting your money in something better. I don't want people to lose money, but on the other hand, it has to start on an individual basis. My public pension fund, CalPERS, is heavily invested in health care, and they shouldn't be. It's driving up the prices of their health care by doing that, but they still are, and when you call them and ask them to stop it, we are here to make money for our members, period. That's it, okay? If you're in a public pension fund, call them and express your feelings, okay? It makes a difference. All right. So, hold on a second. Okay. Now the other part of it is the campaign finance money. And unfortunately, I left my papers behind. Follow the money is the tool I use to find out how much people are taking from healthcare. And you can learn to do it yourself, okay? Especially in California, they have to stop. We really have to get them to stop. They don't need it. Bernie proved you don't need millions of dollars. He almost became our president. Too bad. Unions sometimes have excess revenues that they invest. Ask them if they're invested in healthcare and look into changing it, okay? So little steps like that can change it, but the money is definitely an issue. And it's within our area that we can make change with that, okay? I'm going to try to get a way to send this follow the money tool so you can all learn how to do it. Okay? When you go to see your legislator, take their profile with you and use it, okay? Being a co-sponsor of a bill is nice, but it's not enough. They have to stop taking the money. They have to advertise their being in support on their website, and they have to talk about it at their town hall. That's being a real activist towards single payer. Okay, folks. So that's the end. I just want to end with one thing. This is my chant. People, one plan. Seize the play date.
Salama.
Does it need to tip down? Can you hear me? Can you hear me? Okay. Okay, I know. It's like eating an ice cream is what I tell people. Close. But I don't feel like I'm straddling the thing here. Can you turn it? Can this turn? Yeah. Okay. Great. Okay. You've heard great speeches down at the Embarcadero. I wasn't able to be with you down there. Heard some great speeches now, followed by nurses, led by nurses. I'm a nurse. Nurses are advocates. But first, before I begin, I'd like to start with a Navajo prayer because we are on the indigenous land. Before me, peaceful. I have to see close. Before me, peaceful. Behind me, peaceful.
Never be afraid to make some noise. And get into good trouble, necessary trouble. This is not about go along to get along. That is old school. We're not doing that. No, no. Change doesn't happen by us just going along to get along. What happens with that is what people who didn't vote and so forth and waited it out, you see what happened, okay? Very bad news. But I'm here to talk about, think of how do you create a creek? How do you create a river? A waterfall, a lake, one drop at a time. We are multipliers. Think of yourself as a multiplier, and I'm going to share how. You're not just one individual person, and after this rally, well, gee, what can I do? I'm going to give you some tools.
All right.
And you also have handouts with the QR to do things. But anyway, I am female. That's 51% of the national population, folks. I'm a person of color. That's 40% of the population. I'm a parent, and those who are parents, that's 50% of the population. I'm a grandma. 17% of the population is over 60 years old. Hello? We don't even have to talk about the boomers, okay? As an RN, 1%, but it has been the #1 profession for the last 20 plus years as most trusted and reliable. Okay, we're all about that. Advocacy is what we're about. Plato said, one of the penalties of refusing to participate in politics is that you end up being governed by your inferiors. Are we not there? I didn't consider myself a political person, but I have gotten very political. And I'm going to continue until 47 is out. So this is what we're going to do. You're going to call your representatives. My representative, I live in Marin County, is Jared Huffman. I have his local number as well as the switchboard, which I'm going to share with you. Now, the switchboard number, follow me on this one. 202. 202. 224. 224. 3131. 3131. Repeat. 8. She's got to go back to kindergarten. 202 224 3131. You got it? Now,
the representative for San Francisco, it's by your zip code, is Pelosi for San Francisco. So you would have to find out who your representative is. But if you know this number, and if you memorize it, because if you say it 3 times, you've got it. You can call the switchboard Tuesday through Friday, Eastern time, so you gotta call before 9 o'clock our time, right? Okay. And call that number, give them your zip code, and they would direct you to the phone number of your representative. Now, you might say, well, I wanna call my senator. How many senators do we have, folks? Every state has 2. Okay, you know who they are? You know their names? And the newer one? Yeah, but the newer one? Yeah, that's right. Okay, that's right. Padilla and Schiff. Yeah, so anyway, another number for you for those who want to call directly to the senator, but the switchboard. However, if you do the 3131, they will transfer your call to the senator call. So you just only need to know the 3131. But I'm going to tell you what the one for the senators are. Ready? With me. 202 224 3121. Got it? 2 senators, you got that? 2-1, okay? So basically you only have to remember 3131, right? Okay? And so I would like to see a show of hands of those who will pledge to call that number twice a week until 47 is gone. Can you show up hands? Until 47 is gone. Now that doesn't mean you have to call all 3 people each. You could call just your senator or one of the senators or just your representative. But to make 2 calls per week to that switchboard number and talk about the current issue that you are saying, hey, you need to vote this way or that way, whatever it is, because it's changing every single day. That's something we've got to talk to them about, right? So we really want to do that. So I'd like to end by saying, I believe in intergenerational. I just see a young man here. Although I spoke from the voice of a female, not ruling out any sons, cousins, brothers, fathers, husbands, grandparents of any kind. But I want to end with an African proverb. The young go fast. We need you. The elders know the way. So you need us as well. So let's do this. And what's that number? And you say it to me. 204-3131. Yes, everybody, get with it. If we had music now, oh, that's okay. If we had music right now, I would say in the late 60s, early 70s, the song by Nancy Sinatra, these boots were made for walking. That's what we're gonna do, right? But now the song is, what's the song for about boots now? We got our boots on the ground, right? We all have our boots, and let's do our marches, let's do our rallies, let's do our calls. We have to make noise. That's the only way we're gonna make this change. Okay? Thank you, and I wish I had music, because then I would do a line dance with you.
That was back in the 1980s, but I hate to say it, but it's still relevant. It's called Healthcare Blues. I go to work every day just to try to earn $1. Because my health care costs so much it makes me want to holler. I went to my boss, said I need a raise in pay. He said, sorry, the insurance companies took it all away. Sometimes I wonder what we gotta do, cause we gotta find a cure for the health care blues. Gotta find a cure for the health care blues. just to try to earn them money. My deductibles are so high it ain't even funny. I went to the doctor, I was feeling awful sick. I saw the bill, told the doc, let me die, cure me quick. Sometimes I wonder what we gotta do, guys. We gotta find a cure for the healthcare blues. Gotta find a cure for the healthcare blues. Now there's 46 million people in uninsured situations. Maybe a few million more when this healthcare bill goes through. We gotta take this problem to the capital of this state and nation. We gotta tell those legislatures, and this you can quote, support a single-payer health care or you will get our vote. No longer will we wonder what we gotta do, cause we just find a cure for the health care blues. Single-payer health care cures the health care blues. Yeah. Thank you. Solidarity.
So everybody, thank you so much for being with us today, for fighting the good fight. I think we all have stuff that we can do. Sorry, my vest is falling off me, but thanks. I hope everybody had a chance to take a photo of this QR code. It's a petition to put single payer on the nation's agenda. Remember, we're going to force our Congress to put single payer on the nation's agenda. We have got to make this a public fight. And also, if you're interested in joining the movement of the millions of people that we need in the streets and in the workforce, please sign the sign-up sheet as well. I want to thank all the organizers. There are a lot of us. I want to thank all the speakers. Thank you. I want to thank my son who carted stuff around for us, and Ligia, and the musicians. Thank you. Yes. Thank you, Jimmy, and thank you to the Brass Liberation Orchestra. That was amazing. So I think we're it. I think we're done. Everybody has a phone number that they've all memorized, right? And you're going to call. But most importantly is it's not enough to sign that legislation. They have to make it a public fight. All right, everybody, thank you.